Hi, my name's Joe Rufino, and I'm here at Dr. Joseph's office having chelation drip done. I had it done 4 years ago, and I think it's really done me, or did me, a great, great for my health. Uh, the problem is I let about 3 years go by, and I think the last year was just too much. I went back to my old habits, and I'm back here again instead of having bypass surgery or any of these other procedures that they tried to sell me on. Um, I'd just rather go this way first. I really do think that it helped me out 4 years ago. It's just that it was my fault that I kind of let it slip away and didn't continue on doing follow-ups that might have kept me from coming, getting back to the situation.
Can you tell us a little bit about what happened 4 years ago? Like how bad it was?
Well, they're saying, and I still don't believe it, but anyway, they said I had a very massive heart attack. Should have killed me, they said, but for some reason I didn't fall down. And after them I feel that they were bad salesmen, but they tried to sell me on bypass surgery, telling me no chance of stents, and then after about 3-4 days of finding out that they didn't sell me on bypass surgery, then they try to pull, well, we can do stents on you. They did send as far as I'm concerned, was a high-risk harpooner that said I had to do it in a couple of days because he's leaving the country to save his family in Lebanon. And to me, if I would have had him do it and I experienced problems, they probably would have said, well, the next guy would have said, well, what do you want me to do? I wouldn't have even attempted stents. So doing this chelation, I really think it opened up whatever blockages I did have. And like I said, I just dropped the ball and didn't continue on doing follow-ups and went to my old bad habits. Besides smoking, I just didn't eat right. Stayed away from the cigarettes, but didn't eat right, and you know, started plugging up again. And before it gets real bad, I just thought I'd come back here and start getting things cleared up and try to get back on the right track. Two other places, I I feel good here, and that's why I did 40 drips and never experienced any other heart attacks.
You've done 40 treatments of that?
Yeah, 4 years ago. I did these and 20 plaquettes, which is supposed to open up the arteries. And I did really good for, it's been 4 years to the day, really. July 20th, 4 years ago, I had a heart attack. But like I said, in the last year, in that 3-year period, I had gone from 235 pounds down to about 195. Well, in the last year, I've gone from 195 to 225. And look where I'm at. I'm like, oh man, what's my heart rate? What's going on? So, and like I said, after 40 of chelation and 20 plaquettes, and whenever they did me to the hospital for 12 days, I'd had it with needles.
I know, right?
So let me take a break. Well, I took too long on the break.
So you just started them again?
Just started Monday. This is my second chelation. I did one plaquettes Wednesday, and I'm just alternating. Monday, Wednesday, Friday, just keep alternating. And he said a minimum of 20, maximum of 30 of these drips. And then once I take just a small break, then I'll probably do maybe once a month, once every other month, do a chelation and then a plaquette.